Hello, future nurses. Today, we're exploring a vital part of holistic nursing care, cultural assessment. Understanding a patient's culture isn't just a nice extra, it's a core responsibility if we want to deliver care that is respectful, relevant, and effective. Let's begin by defining what we mean when we talk about culture. Culture is the learned, shared, and transmitted values, beliefs, norms, and lifeways of a particular group that guide their thinking, decisions, and actions. In short, culture influences everything from how people eat, to how they communicate, to how they view illness and healing.
Now, here's something to always keep in mind. Health and illness are culturally defined. What one group may see as illness, another may see as a normal part of life, or even a spiritual experience. That's why cultural competence is so crucial in nursing. Let's go deeper and talk about the characteristics of culture. These traits help us better understand the nature of cultural systems. Culture is learned. It's passed down from one generation to another through language, rituals, and social interaction. Culture is shared. It's not something people practice alone. It's a collective experience that binds members of a group together. Culture is symbolic. Think of language, gestures, or even religious icons. These symbols carry deep meanings in different cultures. Culture is integrated. It's not just about food or clothing. Culture affects the economy, family structure, religion, politics, all interlinked. Culture is dynamic. It's always evolving. Traditions can change, merge, or fade over time, especially in a globalized world. So, why is cultural assessment so important in nursing? Well, it helps us deliver holistic care that includes emotional, spiritual, and cultural dimensions, improve communication, and build trust with patients, reduce disparities in health outcomes caused by misunderstandings or biases, avoid cultural imposition, which happens when we assume our values are universal and impose them on others.
Let's take a look at the components of a cultural assessment. When you're assessing a patient's culture, ask questions around the following. Ethnic background. Where is the person or their family from? What cultural group do they identify with? Religious and spiritual beliefs. Do they follow a religion? How does that affect their view on illness, healing, or even medical interventions? Dietary preferences or restrictions. Some religions have strict dietary laws. For example, halal, kosher, vegetarianism in Hinduism. Family roles and relationships. Who makes decisions in the family? In some cultures, it's the eldest male. In others, decisions are made collectively. Language and communication style. What language does the patient speak best? What's their comfort level with English? What are their preferences around eye contact, body language, or physical touch? Health beliefs and practices. Do they use folk medicine, herbal remedies? Do they believe illness has a spiritual cause?
In the document, there's a great image of a cultural assessment wheel. It's a circular diagram with segments like language, communication style, family structure, beliefs about illness, healing practices, decision-making hierarchy. This visual reminds us that culture isn't one thing. It's many interlocking systems that impact health. Now, let's go over two useful models that nurses can use to guide their assessments. 1. Giger and Davidazar Transcultural Assessment Model. This model focuses on 6 key phenomena that vary among cultural groups. Communication, verbal and nonverbal, tone, eye contact, gestures. Space, personal space preferences. Social organization, family structure, roles, authority. Time orientation, do they focus on the past, present, or future? Environmental control, belief in personal control over health. Biological variations, genetic or physiological differences. 2. Purnell Model for Cultural Competence. This is a circular model with 12 cultural domains, for example, nutrition, high-risk behaviors, family roles, workforce issues, surrounded by a global society ring. It reminds us that no one lives in a vacuum. We're all influenced by society, community, family, and individual experience.
Let's now go over some specific cultural considerations in healthcare that you'll come across frequently. Communication styles. In some cultures, direct eye contact is considered respectful. In others, it's seen as rude or aggressive. Time orientation. Some groups are future-oriented and punctual. Others might be more focused on relationships and flexible with time. Touch and personal space. Some people welcome physical closeness and touch. Others may find it intrusive. Pain expression. Some patients will openly cry or vocalize pain, while others will suppress it entirely as a sign of strength. Folk and traditional healing. Herbal remedies, shamans, acupuncture, cupping, and prayer are just a few examples. So how do we approach cultural care as nurses? Here are a few strategies to guide you. First, reflect on your own cultural beliefs and biases. Awareness of your own perspective is step one to respecting others. Second, use trained interpreters when needed. Don't rely on family members, especially children. Third, always ask open-ended questions. Instead of saying, "You don't eat pork, right?" Say, "Are there any foods you prefer to avoid, especially for religious or personal reasons?" Fourth, tailor your care to be culturally congruent. This means aligning your interventions with the patient's cultural values and health beliefs.
Remember, culture is not just a background issue. It's a frontline factor that shapes how patients seek care, accept care, and respond to care. Your job as a nurse is to be culturally curious, compassionate, and open-minded.
So, that concludes our lesson on assessing culture. See you again on the next lesson.